Evening to our viewers and welcome to this special show dedicated to caring for cancer patients, especially during COVID-19. I am Kamal Narayan, CEO of ISW Council, and this is our third session in the series planned around caring for cancer patients. Of all the diseases a human being may fall to, cancer is considered to be the most dreadful. And sadly, India is seeing a worrisome upward trend in the number of cancer patients being reported every year. Recently, the Indian Council of Medical Research revealed an startling estimation of around 12% in the new cancer cases in the country in the next 5 years. This year, we are estimating to see almost 14 lakh cancer cases, which is expected to reach over 15 lakh by 2025. The ongoing COVID-19 pandemic impacted the cancer treatment considerably, especially during the lockdowns. However, the treatments, including surgeries, other activities such as chemo, radiation, and all have resumed. But some patients may still be concerned due to fear of coronavirus infection. This series is intended to bring authentic guidance from medical experts to all our cancer patients and caregivers, and also to educate general masses about prevention of cancer. What are the problems we are facing when it comes to diagnosing cancer early, and how we need to ensure an empathetic and effective care for those already diagnosed of it? We have today with us a very special guest, Dr. Dinesh Burani. He is a leading cancer specialist and the director of Department of Hemato-Oncology and Bone Marrow Transplant at Rajiv Gandhi Cancer Institute. He is one of the finest name in the cancer care in our country. And before I go with Dr. Burani and discuss about the cancer care aspects, I would like to ask our online viewers to keep sending their questions on the comment box, and we will be trying to answer most of them in the next 40 minutes. We would also like you to comment and share your feedback with this special show, and also you can share it on your wall and may help others who may get benefited out of these information. So, Dr. Burani, thank you so much for joining us today. And I welcome you to this ISW Council program. And we'd like to, begin with a question that how is the situation of cancer-related treatments and services going on, especially after, this graded unlock phases and as the life is kind of coming back to the normalcy?
Thank you for giving me this platform to share my views. Good evening to everyone. I just wanted to ask you: is it we are the English? We have to the language. We has to be English.
We can have, sir. We can have both. Kind of mix also. Mostly, we believe that both languages are pretty understandable for our audience. So you can also use a little bit of Hindi.
Okay. As I said, I'm thankful for providing me the platform to share my views. This was a very big seen in our life. The whole country had been locked out. We never thought the metros will stop, and we never thought the trains will stop. No one will be allowed to go out of the home. The situation was very scary. So the things were very strict in the March and April. A little bit better in May, June, and then the things have released. That release phenomena is still going on, and I think the pandemic is increasing because of this release phenomenon. So probably we were better in the earlier scenarios in terms of COVID, but we could not sustain it because of I think there's a fatigue of the lockdown.
Yes.
In particular to the cancer, people stopped coming to the hospitals. There was an absolute decline into the numbers. The previously diagnosed patients were not coming. Even the people who had a symptoms were not seeking any advice. Initially, it was because of the no facilities available, no transport available, and the risk of corona was suspected to be high, and the people were not seeking the advice. It was appropriate in the beginning, but that has helped to save it from the corona, but it has harmed in the terms of their cancer care. Now say from March to September is roughly around 5-6 months, and many other people have not come out for the advice. Some people have started coming in, so I will say if I divide one third, so 1/3 have started coming up. The other third probably are continuing their treatment with the infrequent some contact by the phone or by the videos, but probably 1/3 are still at home ignoring the cancer and fearing for the corona. And in fact, the people are probably is okay for them to have everything done except the health care. So significantly the cancer care has been compromised. This will have a significant impact on the patient's personal cares.
Sir, you said that around 1/3 people are kind of staying back at their home. तो ये जो situation है जिसमें लोग despite that they have these symptoms and they are kind of maybe suspecting that it can be something which need immediate care, and still if they are avoiding, what is your kind of message for them, and how it can kind of cause a larger damage if the healthcare advice is not sought in time?
See, if I don't have a cancer, I have one enemy. That's a corona. So I have to be protected from corona, and as long as I'm taking care for corona, it's fine. But if I have a cancer, I have two enemies. It's like having a Pakistan this side and China that side. So you cannot ignore the another one. You cannot just take care of Pakistan, say I'll be okay with the China. So you have to take care of both. So if you take one side and don't take the other side, the result is going to be same. Probably if you get a corona, you might come out, but if you don't take care of your cancer and if that becomes resistant, that can be life-threatening. So I will say this is we have two enemies. One is bigger than the new one. We have some would have, the people are in a different phases of their treatment. So someone who's on the active chemotherapy and they left it. So you have ignored the bigger enemy, just hitting have not come up for the follow-ups. They should make a mechanism so somehow you can have the test done and reach to your doctor, say whatever treatment has been completed, or there's an ongoing treatment, whether I can continue from home or not. Some would have completed a treatment long back. Still, they require some follow-ups to make sure that things are fine. They can be a bit relaxed, provided they have agreement with their doctor. So if you are in a different phases of cancer, you have to weigh the two things. Don't ignore the bigger enemy than the smaller one. So my message will be, you have to fight both.
Yes.
I'm not fighting with the one, you have to fight with the both.
How has been or how effective has been this teleconsultation process in cancer care?
I think the things what good has come out of is a teleconsultation. There are some bad things with the lockdown, some there are good things in lockdown. We have realized a few things can be done without coming in. Imagine the person who is in a village, comes to the Delhi, he has to have one attendant or two attendant with him, then he comes to the hospital, go through all the tests, waiting for the doctor. It takes a lot of hassles, and so many times it's not possible. If the follow-up patients, if some of them do not have a major problem, can be followed up on the video consultation. It has not been still taken up by the many of the Indian patients, but I think it is feasible. It's not only is happening here, in the Western world also has realized. So many of the hospitals, many of the institutes have come up with their consultation, but they are proactive. So they have a list of the patients, they know who is on the follow-ups, and people do a video consultation. So the institutes or the patients are proactively making sure the continuity of the care is there. Here, because it is a paid system, unless the patient wants it, the institute cannot contact, hey, okay, you're not come, please come, and this has not happened. And the patients have not contacted, many of them. Either they are not aware of the video kind of a system, or they don't like it. Probably most of the things is awareness is not there.
Not comfortable, or they're not kind of getting.
The awareness is not there. So many other people haven't thought about it without going, and somehow we have to pay for the video consultation because all the institutes will be charging it. That thing has not been accepted easily by the people. So it's a mixed bag. Majority don't know. Some people don't know it, probably not accepting it. Just you have to pay for the what services has been provided, and the charges are huge. The charges are probably similar to the what you will be paying for the OPD in consultation. So the charges are huge, and people are still not come to the terms of that.
This is interesting aspect, Dr. Burani, because during the, I think, first 3 months of lockdown, and during that phase, and immediately after that, we were kind of going very, very, gung-ho about, teleconsultation, and that was a kind of new normal. Is it continuing to be that, or now patients are more, kind of comfortable coming, whomsoever are ready to come to the OPD and get the physical consultation rather than just go for the, the online?
Somehow whoever has used video consultation, they're not fully satisfied. We are used to the personal touch and personal examination kind of a consultation. So the people who majority have not utilized it, some have utilized it, they're not comfortable with it. So the people who are close by to the institute, say Delhi or the close by cities, they still come, and the people who are far away, some of them have utilized it. Not many people have used it. So that has not been, I'll say the Rajiv Gandhi is a big institute. So far there are 350 consultations in the last 4-5 months. Which if you see a OPD, we used to have 100, probably 300 patients in a day consultations, the whole Rajiv Gandhi. So you can imagine that kind of a video consultation utilization is. One important thing has happened. I do a video charity function. I used to go to Gwalior as a charity clinic. Then because of the lockdown, I couldn't go. So I started doing a video consultation free of this. Some people, it's very convenient. So if I was going to the Gwalior, someone coming from Morena, they still had to come up from far. They had to wait for me, and they had to go through it. And now I get their reports on my WhatsApp, and then I call them on the video. And they sometimes feel excited about this. They can still see me and talk to me without moving out of the house. So it probably is a simpler, provided if someone is paying it, then probably don't feel is enough.
That's very heartening to know, actually, doctor, because these are the people who actually put in a lot of effort to access healthcare in bigger cities, and as you are saying, Bhind, Morena, I think even people are going from places like Chitrakoot, Banda, Mahoba, which are quite far from Gwalior. And they travel all the way to the Gwalior, for relatively better care, especially those who can't come to city like Delhi. And that's very good that the people at rural areas are kind of adapting to this new normal faster.
If you call them, they are very thrilled.
Yeah.
And, if you call them, say, look, Dr. Burani is calling you, and then you're on the video and talking to them. Yeah. That clicks them. So at least without reaching to me, they at home itself they can talk to me. So this, which I think initially, even the people who are coming to Gwalior will be restricted to the close by cities. Now, say if I'm available to the whole India. Someone from, so even our senior doctors are available to the whole country. So you can access anyone sitting at home with the video consultation. So I think we are in this exciting era of telemedicine.
Telemedicine, which will reach to, I think, those interiors who actually take a lot of pain to get healthcare. That's good. But doctor, those who are actually walking in and actually, need more physical, kind of treatments, procedures, and all that. What is the new normal for them? Is it going to, some different kind of protocols being followed in hospital, especially, like super specialty kind of thing, cancer care and all that? Or it is, kind of just a simple hygiene practices?
Initially, there was a lot of restrictions and fear was there. So all the people, I mean, not everyone was allowed at institute. So only the patient was allowed in the beginning. The only patient was allowed, even a single relative was allowed unless the patient requires assistance. So the patient used to be allowed. And then before that, there was screening was there. Then you clean them and everything. So there was a lot of restrictions. Most of the restrictions have eased out. Still, the patients who are coming, I think only one attendant is allowed. That is a good thing. Previously, if you had a one patient and you had a multiple attendants coming in, I think we can get away without having too many people making a crowd without much benefit. So that's a good part. People who are getting admitted still require a COVID test done. If you are a new patient or if you have any patient with a fever, they still require the COVID test to be done. We were relaxing it when the Delhi had a lesser numbers. I think again we have to ramp it up. The patients who are coming, they should use a mask, maintain a social distancing. I think more you are aware of your precautions. I think the person has to do it. There's nothing else. There are certain restrictions the hospital can put in, but still you cannot be safe from corona unless you make your own efforts to. Even if you are going to the hospital, even you are using your mask, if you don't put it on the nose, you are still on the risk. So you don't require a false safety. You need to have actual precautions.
You have to become your own corona warrior. Everyone has to now become
no
that.
Other hospital or no other facility or no other restrictions can protect you. That's what I have realized.
Dr. Saab, we have, so we talked about what are the new normal in corona. As far as this cancer, prevalence in India is concerned, and as I was, mentioning some of those numbers, we are looking at that, the increasing number of it, and many of the oncologists also believe that it can be more than 12%. It is not going to be just 12% because it is also a fact that a lot of cases are not getting actually reported on time, and that also is one major part of that burden. What are these main types of cancer which in India is kind of facing, and how many of them can be prevented? What are the ways available to prevent, apart from the other lifestyle changes and all?
One thing is the prevalence is increasing. The number of patients with the cancers are increasing. That's the truth in India. There are a multifactorial reason for it. One is previously most of the people had a problem with the infection. So we used to lose the significant number of the people, and even in a younger ages because of the infection. So they were not maturing it. The age was not increasing. The average age was lower. So that's why we were not seeing many cancers. Now the average age is increasing. People are not dying of the infections. We are seeing more cancer. So if you see a Western societies, probably we are moving to the age bar is increasing, and we will be seeing because of the increasing age. Second is our lifestyle and the food has changed. If you compare with the previous kind of a walking, cycling, and the physical activities used to happen, we have gone to the sedentary kind of a lifestyle. So previously was an active lifestyle. Now we have gone more towards a sedentary lifestyle. So the lifestyle and the food, the kind of atmosphere is there. That has also increased the risk of the awareness has increased. Previously, not many facilities were available. So now there are even a smaller places. The diagnostic facilities have increased. People have got the money. Previously, the treatment was much more costlier than your income. Probably in the last 10, 20 years, the income has gone up. Even the treatments, at least the diagnostic part is not still, you can afford to have these things. Previously, patients never used to come to the cities. Now the trend is and people are now taking care of the health. Previously, the people never used to take care of their own health. Used to ignore the few things. So I think the numbers, because of these multifactorial things, are increasing. The second was how to prevent it. There are many cancers which are preventable. Many things which are the most common cause is tobacco. So that's a smoking or chewing the tobacco is a major cause of the majority of the cancers in India. So that's an important thing which can be prevented. It can be active smoking, it can be a passive smoking. If someone is smoking in your house, probably you are also exposed to that. So there are a few things which can be prevented. So the lung cancer, the GI, the esophageal cancers, which can be the mouth cancers can be prevented by the tobacco, preventing from the tobacco. Second is alcohol. So the liver cancer can be prevented from the alcohol consumption. The sedentary lifestyle can give you the diabetes, hypertension, the malignancies. So these are the part of the sedentary lifestyle. We have come out of the infections, but we have gone to the non-infectious, non-communicable diseases, and the cancer is among them. There are a few things which we can prevent it. There are a few things which cannot be prevented. Like still many of the blood cancers cannot be prevented. So, but the major chunk which we see commonly are related to the lifestyle, and many things
can be prevented. Sir, when it comes to changing lifestyle and kind of stopping tobacco and stopping alcohol consumption are definitely two important aspects. But as you mentioned that the food, the air, the kind of water, almost everything has got contaminated. Now, what is the way for a general, for a normal human being to stay healthy and especially, avoid something like cancer in this kind of scenario? Is there a, kind of some suggestions from your side in terms of how to change your food habits or how to change your, other behavior that helps at least, kind of, tobacco you stop, that's one thing. But I think cancer is also being caused beyond tobacco as well. As we were seeing that a lot of lung cancer cases are being reported in city like Delhi, especially among those who are completely a non-smoking, kind of set of people. So what can we do to, kind of at least avoid this?
It's not only the tobacco, the alcohol is the second one. So when you say tobacco, we have to be mentioning the alcohol also, which are easily preventable. But yes, still, if you ask me and if I tell you everything, then you will say that people should have all the tough lives. They cannot have, they cannot eat pizza, they cannot have a fat, they cannot have everything. I think we have to balance it out. More of a physical activity. So I will say more of a physical activity. So walking, cycling, or yoga, this kind of activities, and cutting down the fat. So if you cut down a fat of your body, probably that will be one of the major things which will help you. Probably we have to have a more cleaner food. Eating from every vendor on the street, we have to demand for the cleanness. Unless we can drink any water, we can drink, we can eat everything, probably is not safer. These kind of things can give you the infection, and infection sometimes can contribute to the malignancy. Even if this can, the contaminated things can be have an indirect role in the causation of malignancies. So you can't have all the sadhu's life kind of, but I'll say probably a balanced life with cutting down the fat and cleanness. Whatever you eat has to be cleaned and.
I'm trying to incorporate the questions on the general answers, but there is also a little bit of a specific kind of question. I'll just share with you if you may like to address this. What is the diet to be followed, and what type of treatment will be given for a condition called PT3N1? This seems to be very technical. I'm not a medical expert, so I don't know, but you can tell us if you want.
I'm a hemato-oncologist. I'm not a medical oncologist, so I will not be able to answer all the malignancies. But means for the specific cancer, if there is a certain diet, you have to contact your doctor and ask for the specific diet. Someone has a cancer, then the diet will be different. Someone wants to prevent a cancer, the diet will be different. So if you want to prevent a cancer, it has to have a healthy diet. If you want to, I can't say you should have that many protein and this much here, this one new. That you're balanced diet. No. less of a fat. I mean, what is happening in our life is that because the physical activity has reduced, and probably we are accumulating more of a fat. So more of a physical activity, the diet which contains a balance, probably the good amount of protein with a less of fat will be the diet advisable to prevent. But once the patient gets a cancer, ask your doctor what modification, because everyone will even a specialist with every cancer may have a different, someone has a diabetes, someone has a kidney failure, and then you get a cancer, you need to modify many things. So I cannot give a right answer for the patients who have got the cancer.
Thank you. So I think, and we also endorse that patients do go to their doctor and consult them. These discussions can help them, overall understand the situation, but, for a specific clinical input and the medical input, they should definitely consult their doctors. Doctor, since you are a hemato-oncologist and you talked about that there are blood cancers which are, kind of not preventable. But what those, what all kind of blood cancers we are seeing largely in India, and what are their prevalence, and what are the kind of the treatment procedures for them?
When we say hematological malignancies, there are three types. One is called a leukemia, when your blood cancers are in your blood. So they are called a leukemia, something which has spilled into the blood. So comes from the bone marrow is factory for the blood. So the cancer originates into the bone marrow and comes out in the blood is called leukemia. The other one is called a lymphoma. Some of the cells which protect our body, they originate from the bone marrow and they go into the glands. It's called a lymph nodes. The function of them is to fight infection. So they are in all the parts of the body. Whenever you have exposed to the infection, the cells fight with the body. But when they become cancerous, it's called a lymphoma. So one is a leukemia, which is in the blood. One is a lymphoma, which is mainly in the lymph nodes, which the cells originates from bone marrow, goes to there. Another one is a myeloma. It's a cancer of plasma cells. So these are the bone marrow cells, which makes the antibodies for the whole body. They also fight with the infection, but when they become cancerous, it's called a myeloma. So there are three types of major cancers. When we talk about leukemia, they are acute and chronic. Acute means they rapidly come, and if you don't treat them, the patient will die. So the very rapid course is acute leukemia. Some are chronic. Some chronics is slowly coming, say in the last 6 months or 1 year, they would have been in the body before you find out. And even if you don't treat them, the patient can survive for a few years without a treatment too. So they're chronic kind of blood cancers. Lymphomas also, there are two types. One is called a non-Hodgkin's, one is called a Hodgkin's. They all are cancers of lymph nodes. I don't want to go into the details of this. The third one is a myeloma, which originates from the bone marrow, mainly affects the bone and kidney. So these are the three men. Majority of these things requires chemotherapy. There is no major role of surgery. There is no major role of radiation. There may be some role of surgery or radiation, but the major role is chemotherapy. Now, what has happened in the last few decades is that chemotherapy has been replaced in a major of the things with the targeted therapy. And some of the cancers requires a bone marrow transplant. So you require a chemotherapy, then go for the transplant, and some may go directly for the transplant. So the bone marrow transplant plays a major role in the blood cancers treatment, either upfront or at the relapse setting. So these are the main things which are. When I was talking about the targeted therapy, one of the disease I will call it the chronic myeloid leukemia. It's a chronic leukemia, chronic blood cancer. Previously, only curative treatment was bone marrow transplant. Someone was diagnosed, go for the transplant. The majority of the people were not able to afford it, and they used to die within 4 or 5 years. Now we have a one tablet. It's called a targeted therapy, and we don't have a one. We have a 3 or 4 types of tablets. The people, if they keep taking the tablet, they survive for a normal life. So, provided you follow the rules, you can have a near normal life with the targeted therapy. So the things are quite changing, not in a one cancer, there with the various spaces in the different cancers.
So along with this targeted therapy, and which is, I think quite promising in comparison to chemotherapy, which, kind of people have a perception that it is quite, painful. What are the other improvement on, these treatment, which is making it kind of more efficient and also less painful or more, kind of comfortable for patients? also about this. What is this immunotherapy also? I think being used by the oncologists these days. Do you also use that? And what is that?
When we talk of all the drugs have the medicines, has to be either injection or is a tablet. So either you take it from the mouth or take it through the injections. They all are called a chemotherapy. Something which kills a cancer is called a chemotherapy. Even the targeted therapy, actually a form of a chemotherapy because they're killing the cancer cell. Previous chemotherapies was like a bombshell. You have one terrorist in one place, you blow out the whole house or blow out at least a part of the house. So the normal things also will say, if there are 10 normal people sitting with one terrorist, you probably will be killing 10 normal people along with the one. So previous chemotherapies was like one bomb blast, you kill it. Like Hanumanji brought a whole thing in spite of one particular plant. He brought the whole thing. So similar kind of you do as a whole thing. But the targeted therapy means you know where who's your cancer cell that goes to that place, kills a cancer cell, does not kill the normal cells. So we are moving in that direction. We have not reached to the 100% targeted therapy. Probably somewhere the chemotherapy alone, somewhere is the targeted therapy alone, or somewhere the combination of both is called is required. There's a lot of advancements are happening. Probably the role of chemotherapy will slowly go down. At least they will become a lesser part of the therapy. More will be a targeted therapies. The disadvantage of targeted therapy is because they come with a cost. The cost is a major hurdle. I'll talk to this later. Immunotherapy is also one of the targeted therapies. So the mechanisms are different. So immunotherapy, when we talk, they attack your immune system. So like if you take one antibody, take one immune cell, attach one of the thing to the antibody that will go to the cancer cell, attached to that cancer cell, and that antibody will kill this. So your immune system has been brought to the cancer cell together, and this immune system kills your cancer cell. So the job of the drug is to bring them together. Somehow the cancer has developed the mechanism to run away from the immune system. So wherever the immune system was, they used to stay away from that. They used to make the immune system less competent. So the immune system was there, but the cancer cell, they were not able to kill the cancer cell. So there are drugs which brings them together and makes the immune system more efficient to kill the cancer cell. So that's the immunotherapy. But all come into the one umbrella is called a targeted therapy.
Thank you. You mentioned about that targeted therapy is little expensive, but incidentally, we are getting the question on the same line from a patient, and you have already described the difference between the two, and I'm sure our audience would have got that. What is the difference in the pricing? How much? What is the difference broadly?
All the previous chemotherapy, there is no new kind of the chemical chemotherapies are not there. So all the majority of the chemotherapies are the older ones. So you can have a different combinations of the drugs which are given as a chemotherapy. So they all are old. Whenever there's a lot of research is required to find out the molecule, to make that molecule tested into before the human has to be tested into the cell line, the animals, and there are a lot of trials has to be done. We all will be aware with the vaccine. Say the vaccine is required, but requires a lot of trials before that. You can't just make all the vaccines are available, but cannot be given to the public unless you find out it is effective, it is safe, is not going to do much of a harm. So there's a lot of money spent on the research. And all the pharma companies, they spend a lot of this thing. But what they spend on the research is one part of what they earn. So probably they make the money on say 100 times on that. So all the newer molecules, there's a patent, at least 10 to 12 years of patent is there. So if any research molecule comes in, it goes into so because there's a monopoly, they go for the huge charges. After certain period, say 10 years, then the other companies also can make it. That's called a generic drug. So some of the molecules have become older. So we have a generic brands. Once you have a generic, good part is there are many pharma companies in India. So there is a competition among them. And because of the competition, we have a price advantage. You get the best price rather than when you have a monopoly. But still, there are a few molecules which are patented. Is only one company can make it and can sell it. That makes the price much higher. There are a few drugs which are in the lakhs, many lakhs. So the one dose or the one course becomes very expensive. So they're very effective, but they're out of reach.
But are they covered by any of these government-supported schemes or the general health insurance schemes also?
So one is a private insurance, and now they are slowly covering it, but no one wants to give you the money. They are ready to take the money, but when it comes to the giving the money, they call it as this is a targeted therapy, so they want to cover it. So there are many unwritten rules are there. When you go to take them, there will be a lot of conditions written. You never bother to, when you sign it, and once you suffer and you go back, you will see you have signed on many conditions.
Even if you are covered for that much of amount? Even
if you are covered, they will not give you the money for the targeted therapies. So there are various companies. They all have a different rules. Some will cover it apart, some will not cover it, or some will cover a full. So there is a lot of hidden things which when you sign it, there are a lot of small things will be written on that when you sign it.
Maybe a message coming from you to our audience also to be very careful when you are, kind of taking a health insurance. Be careful about at least these.
Careful about things are a little complicated. It's not everyone even tries to is easy to understand. The second thing, the government schemes. The government is a broad umbrella. So when it gives you, there are not many conditions on it. So the majority of the drugs you can still procure it through the government scheme. The problem is the government scheme is not available to everyone. So like CGHS is available to the central government employees. So the few of them are very good. There's no discrimination between which drug is covered, and majority of the government schemes they are not covered. In fact, some people take extra advantage, even though it is not indicated. They overuse the funds. But that's not available to many people. So that's a hard part of the government schemes.
There's one question also from our audience. What is the survival rate for a child suffering from blood cancer?
The childhood cancer, the most common cancer is a blood cancer. It's called ALL. It's a fascinating story. If you were born in the 60s, the results were 5 to 10%. Now, if you are in a say 2020, more than 90% of the ALL, the leukemias are cured. So it's been a true success story in the last 4 or 5 decades. Now, in fact, they are trying to cut down the toxicity of the chemotherapy. So at least the patient is cured of it, should not have a long-term side effect. So someone requires this much chemotherapy, someone requires this much chemotherapy. So you tailor it without compromising the efficacy. So in general, all the cancers in pediatric age group, they do well. Among them, the most common is acute lymphoblastic leukemia, ALL, and the majority, the treatment is long, but the people do get cured.
90% of them get cured in this scenario. Great. So, doctor, apart from this, since as you see that a lot of patients are kind of staying back at home, and we discussed about that. So what is your broad kind of tips for them in terms of maintaining or taking care of themselves, in terms of even if they are on the follow-up of phases of cancer care, or what is the tips for or suggestions for the caregivers that when they should definitely kind of not delay the treatment or any kind of follow-up procedures?
I'll take it into 2-3 parts. One is we don't have a COVID era. One is a COVID era. I'll talk to later. Whenever you find something is with your body wrong, something is wrong with your body, do not ignore it. Even a small thing. One thing, you should have your own general physician. You should have one physician which is close by to you. Probably do not charge much. Even if you charge it, whatever problem you have bring it to his notice. So something which is not getting better, say something has arisen and you're not bothered, but something is nagging you for a month or more than a month, make sure you are showing it early. So the cancer, if detected early, even a bad cancers can be cured in early stages. We tend to ignore it, especially in the female. they take care of the others. So the people will be taking care of the kids, the people will be taking care of their husbands and the parents, but they don't take care of themselves. So we tend to ignore it. So don't ignore anything. Don't compromise with your health at the beginning. So the most important thing, I think, what we miss it, what we differ from the Western world, we tend to ignore the initial presentation, and we then present it in the higher stages of the cancer. Even a curable cancers in the higher stages will have a less fruits than so whatever is happening in your body, something which is not getting better, is not going away, should not be ignored. Whatever, then you do a research in the sense, if you have a suspected cancer or you are diagnosed with the cancer, you want to have a doctor. You do a research, A doctor, B doctor, C doctor, or D doctor. You want to have opinions on whatever you do it. Once you finalize he's your doctor, trust him and do whatever he says. Follow him blindly. If you, on the way you feel he's not right, you can take an opinion, you can change the doctor. But when you change it again, then follow that person. Then not try to mix. And we have a lot of relatives and the neighbors, they tend to sway you on this. And so you will get 1,000 advice. Be wise. Which one to? You have a cancer. Ask the 4 experts about this, but don't ask the 4 neighbors. What is happening? We tend to listen to the 4 neighbors, which are not experts. They'll be here and say many things will be happening. They will have an experience of one, or they would have heard from someone else the different cancer story. They will try to fit it in with you. So if you have a doubt, ask 4 experts. No problem. Try to ask experts rather than you tend to the relatives. The role of the relatives and the neighbors should be to support. Not to this advice, just to support it. So that you have to be wiser when you choose it. Strictly follow your doctor. Then comes a COVID era. COVID era, many people have compromised. Don't compromise. Utilize this telemedicine. Utilize the phone of your doctor. Ask him how you can approach your doctor. Try to get him. And if you can't get him, try to get another expert of your field, and make sure you are not drastically away from your care. Your care in COVID era should not be compromised. You cannot go, but the good part is the telemedicine is available. You can talk to the people. The video calls are available. Imagine there was a time when you had to you had to make a trunk call. That nothing was available. Now everyone has got a WhatsApp. Right? So I can call anyone and talk to them with the video. So utilize all the facilities available to make sure your care is not compromised.
Very nice message, Dr. Burani. Catching all signs which your body is giving early, so that anything which you feel is not right, you should seek help of the doctors and experts. So understand that it may be those beginning sign of something big. So you should not avoid those things, as Dr. Burani is saying. And also very interesting aspect is that trust your doctors. I think that is also very important for the entire healing process, because if you are not trusting the doctor, do your research as he said, and then once you decide on the doctor, trust the whole the process which you are going through, and also your family, neighbors, relatives should all help you on it, give you that emotional support, your that kind of that social support to you. So thank you so much, Dr. Burani. It was wonderful talking to you, and we had some very nice advice from you on this. So here was Dr. Dinesh Burani answering our your questions, and also talking about cancer care and prevention during COVID-19. If you have more questions, you can send them to us through WhatsApp, and to use it, you can click WhatsApp button on your Facebook page. Also, you can share, and we will be sharing those questions with the Dr. Burani. You can also consult with him at the Rajiv Gandhi Cancer Hospital if you need, and he, as he said, he is also available on tele consultation, so you can get your consultation booked through that as well. Also, don't forget to follow us and stay updated on all that concerns your health and well-being. This program was supported by Silpa Medicare Limited under their public awareness initiative. And we will be back with another special show on cancer prevention and care on the next Thursday. So keep sending your questions, and we will also try to include them in the next session. Till then, stay at home as far as you can and as much as you can. Eat healthy, sleep well, keep giving your mind and soul a daily dose of positive thinking. And don't forget to maintain personal hygiene and social distancing to protect yourself and your loved ones from COVID-19. Goodbye, and thank you so much for watching us today. Thank you.